Can you do me a favor, Dr. Wernette, and explain to us what is polysomnography?
Yeah, absolutely. So polysomnography or PSG is sort of the gold standard in sleep science for measuring sleep. And that is because it is done in lab. It uses really technologically advanced machinery to look at different physiological markers of sleep. And then someone who's really well trained in sleep looks at that data on the computer on the back end. And so polysomnography, when you kind of just break it up into its parts in terms of a word, just means multiple sleep recordings. So poly meaning multiple, somno meaning sleep, and then graphy meaning recording or writing. So it's just a way to basically use multiple sensors. The sensors that are used in polysomnography are EEG, so looking at brainwave activity through the scalp, um, EOG, which is electrooculography, which looks at different eye movements, EMG, electromyography, which looks at muscle movements, and then also on the face and then on the legs. And then also uses EKG, breathing bands, pulse oximetry, a bunch of different measures. And it uses just the measures that need to be used to look at how you would stage sleep, look at sleep onset and offset, based on brain activity, muscle activity. But then also it's really predominantly used in clinical environments to help diagnose different sleep disorders. So, for example, the reason why you would put EMG to look at muscle activity on the legs is to look at things like restless leg syndrome. The reason why you would put breathing belts on or look at pulse oximetry and use like a nasal cannula to look at pressure flow would be to diagnose things like sleep apnea. So it can be used both for just understanding sleep measures in their best form, but then also diagnosing patients who have potential sleep disorders.